I have been waiting to use this.
Wow, it's so pretty.
Here come the
Red.
I've had it for a couple of years, and we've been shut down because of COVID, and I hadn't had a chance to use it. Now I get to use it. Call the meeting to order.
Are you going to use that for other purposes?
Yeah, but I will just use it to call.
These in between.
So I will, March 28th, 22, call the meeting to order by reading our public charge. The Board of Commissioners ask its members and citizens to conduct themselves in a respectful, courteous manner, both with the board and fellow citizens. At any time, should any member of the board or any citizen fail to observe this public charge, the chair will ask the offending person to leave the meeting until that individual regains personal control. Should decorum fail to be restored, the chair will recess the meeting until such time that a genuine commitment to the public charge is observed. And I will ask Commissioner Carter if she will lead us Pledge of Allegiance.
Pledge allegiance to the
flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
Thank you. So, Commissioners, there are a couple of things I want to mention as we, first of all, are there any agenda adjustments? Seeing no hands, we're going to move on to hearing our announcements. And I am going to ask Ms. Wallace if she will read our announcements for us.
Good evening. Good evening, Commissioners. These are the announcements for tonight's meeting. Just a reminder that they will also be on our county website, and they should be displayed on your TV monitor. DECO Public Health COVID-19 Vaccination Clinic Hours. COVID-19 Vaccination Clinic at the Durham County Department of Public Health, 414 East Main Street, have the following hours to get your free vaccination. Monday, Wednesday, Thursday, and Friday, 9 a.m. to 4 p.m., and Tuesday, 9 a.m. to 5:30 p.m. Appointments and walk-ins are welcome. All doses are available. And please note, clinics are closed between 11:30 a.m. and 1 p.m. daily. For more information, please visit www.decopublichealth.org/COVID vaccines or call 919-560-9217. Durham County seeks input on potential use of ARPA funds for broadband service. Durham County is holding an information update and listening session on Thursday, March 31st from 7 p.m. till 8:30 p.m. This session will be held at Durham Technical Community College's Northern Durham Center, located at 2401 Snow Hill Road, Building 1. This session will provide updates on previous efforts to improve broadband and explain the current request for proposal RFP process. For those who cannot attend in person, you will be able to access the meeting on the Durham County YouTube channel and the Durham County Facebook page. Second Annual Library Feast, the Food Edition. The Durham County Library and Durham Library Foundation are hosting the second annual Library Fest from April 18th through the 23rd. Library Fest is a celebration of public libraries, and this year's theme is all about food. Fest will be comprised of in-person and virtual programs for all ages. Learn more by visiting www.durhamcountylibrary.org/libraryfest. Poultry with a purpose. Are you thinking about getting backyard birds or starting a small egg or pastry poultry business? Sign up for this free virtual workshop on Thursday, March 31st from 6:30 till 8 p.m. from the Durham County Cooperative Extension today. Registration is required. There is a link that is, again, on the website. And if you have additional questions, you can email Janelle, that's JANEL_OHLETZ@ncsu.edu. Decode Tax Live Chat Communication. I have a question for the Durham County Tax Administration. They have a live chat communication feature for obtaining property tax information. Residents can chat online with a member of Durham County tax staff by visiting www.dconc.gov/tax and look for the Chat Now link. Subscribe to Scoop. Be sure to check out the latest information and inspiration news bulletin entitled Scoop from the Durham County Department of Social Services with you in mind. It's full of program updates and practical living tips. To get your scoops delivered to your inbox, please email DSS Public Information at dconc.gov. Need help buying food? SNAP or food services may be able to help you. For help with the SNAP application, please call Katie Forrest at 919-909-7469. For Spanish, please contact Ms. Guzman at 910-705-5504. Also, WIC, a special program for women, infants, and children. To get more information, you can also contact Lincoln Community Health Center at 919-956-4042. Rabies Vaccinations. The Durham County Sheriff's Office, through its Animal Services Division, offers rabies vaccinations by appointment only on Tuesdays and Thursdays from 9:30 a.m. till 11 a.m. and 2 p.m. till 3:30 p.m. There is a $10 cash-only fee, and they are asking for exact change only. Photo ID is required. You must stay in your car with your cats in carriers and dogs on leashes or in a carrier. Don't be late. The Animal Service Division is located at 3005 Glen Road. For additional information, please call 919-560-0630. And lastly, sign up for Alert Durham emergency notification. Spring is here. That means the potential for severe weather, including strong thunderstorms and flooding. Durham County wants to keep its citizens informed and safe in case of an emergency. Sign up for Alert Durham to receive notifications about severe weather, unexpected road closures, missing persons, and evacuations of buildings or neighborhoods. To sign up, please visit www.alertdurham.com. Thank you.
Thank you, Ms. Wallace. As always, you do such a great job with our announcements. Just would like to bring the board's attention to, and I left the communication in the car, but Craig Ray knows about the grant that we received. If you'd like to mention those, Ms. Ray? The 3 that we got from Congressman Price. You don't have it? Okay. All right, thanks. I left mine in the car. But, yeah, we can bring attention to it at our next meeting. All right. Any other announcements from Commissioner Jacobs?
Thank you, Madam Chair. One thing I just wanted to do is encourage people to sign up for the Durham County e-newsletter, Durham This Week Online, because even though we have very long announcements, they are only really a fraction of the different programs and services and meetings that are happening in Durham County, because we would have Miss Wallace reading for a long time if she was really going over all of them. So I really want to encourage people in the community to sign up for the newsletter that is on our website. And just want to highlight a few things that were on there that I think are also really important. One is the Durham Pre-K program, which is one of our really important programs, is having a meeting coming up on April 7th from 6 to 7 p.m. and encouraging parents to attend that meeting. If you have a 4-year-old, a child that's going to turn 4 by August 31st. I also wanted to mention an important program that starts today from the city that is helping people with down payments on homes. $20,000 down payment to help with closing, also with closing costs, and you can find more information on the city website. And then I wanted to punt over to Commissioner Burns, since she is our representative to the Community Wellness and Safety Task Force, and not steal your thunder about the town hall that is coming up.
They moved that initial town hall to the 26th. So yeah, so I wasn't gonna mention that one until we got closer to it, and we will make sure that Monica has that one. But she took the one I was actually going to say about the new grant that's opening with the city. Next month is Affordable Housing Month, so we're building affordable housing. The city's building affordable housing, and now they're making an investment in affordable housing. So we do want the public to know that your elected officials do take it seriously. I don't remember all 3 of the grants, Commissioner Howerton, but I do know that one was about $250,000. This is from Congressman Price, the Bull City United. The other one was about $8 million to the Harriet Tubman Recreational Center. And if somebody could remember the third one, that would be helpful. But just you all know that we do work very closely. Shout out to GM Joanne Pierce. There are a lot of GMs that work very closely with our congressional staff to bring in funding. But yes, there will be a town hall. So as always, please follow up, on Facebook, sign up for our newsletter, and also make sure that you follow up with Clerk Toomer, and we will be having a new town hall on the 26th. There was something else I was going to say, but Congress passed the Crown Act, so they followed behind this all-women board. The House did. Hopefully the Senate will do it. Carolina plays Duke on Saturday. I know that we'll all be interested in that. I won't say who's going to win. I already know who's going to win. The sky's Carolina blue for a reason. And shout out to our new county manager and our county attorney. You all are always wondering how we're going to make investments in ARPA, how we're going to make investments in broadband, and how we're going to make investments in opioids. Well, the 3 of us were actually blessed enough today, and I think some other staff members will be going tomorrow. We sat in on a strategy summit today with the North Carolina Association of County Commissioners. So I do want you all to know that we're taking this very seriously. It's not just us holding town halls, which we will continue to do, but it's also us going out and making sure we're picking up best practices and compliance. Because when we pay for something in Durham, we want to make sure that it's paid for. We don't have to send money back to the government, and that we make the best investments for our residents here in Durham.
Anyone else? Commissioner Alam? Can't hear you.
I was just going to say that Commissioner Burns forgot to mention one thing, that the NC State women's basketball team also made it to the Elite Eight, so let's not forget about them.
So, yes. Right, yes. Thank you. as I jumped in the car and put it on my dashboard to bring in, because I'd gotten the letter from Congressman Price, and I left it on the dashboard. But that just lets you know the staff put together those grants and got them in on a very, very short period of time. And we got them signed and sent off to him, and he pushed them through. That's the kind of work that a congressman does for Durham to make sure that we get some of the things that we want. So we just have to lift him up and thank him for doing that for us. And as the board mentioned, there's so many, just for the public, there's so many items on our announcements. It's very, very difficult I know if I'm listening to the city, it's hard to remember those things, and the best thing to do is write them down or go to the website, because the Durham County website will have all of those announcements there, and you can read more about them and write down the dates and the time for them. Okay. All right, we're moving on now to, is there nothing else? Our minutes, 220191. A work session minutes, March 7th, 2022, and our regular session, March 14th, 2022. Are there any edits or adjustments to the minutes?
I move for approval, Madam Chair.
Second?
It has been moved and properly second for the minutes. Clerk will call the roll.
Commissioner Long, Commissioner Burns,
Aye.
Commissioner Carter,
Aye.
Vice Chair Jacobs,
Aye.
and Chair Howerton.
Aye. Been approved unanimously. Next item, 220218, is our ceremonial items. And we have an introduction to Claudette for New Lincoln Community Health Center CEO. The board is requested to, for the introduction. Is she here? Okay. Yes. She has served with distinction at Lincoln in several key positions, including CEO, Human Resource Director, Human Service Director, Corporate Compliance Officer, and Personnel Director, Personnel Analyst, and Personnel Technician. She began her career at Duke University in administrative support and quickly rose through the ranks of healthcare leadership. Welcome, Joy.
Thank you. I would like to thank the board for this opportunity to speak to you tonight and for this introduction. It brings me pleasure to have this opportunity and to continue to serve the Durham community. As I look around the room, I see so many faces that I've worked with over the years, and I'd like to acknowledge our chair, Commissioner Howerton, who has actually served on the Lincoln Community Health Center Board, our vice chair, Commissioner Jacobs, who currently serves, Commissioner Carter, who has served as well. We have board members here, former board members here, so we've worked with a lot of you in the past, and we look forward to meeting and working with the rest of this board as well. Quality health care is a personal thing for me. Having grown up in eastern North Carolina in a little community outside of New Bern called James City. And it resonates because of its long history in the African American community. And what we like to say about James City is that we were the first African American settlement in North Carolina. My brother died at the age of 15. My parents died in their 60s. So access to quality health care is very personal to me. New Bern didn't have a community health center until a few years ago. So again, if that access had been present when my brother was 15 in 1970, he might be here today. Lincoln Community Health Center continues to serve the Durham community with excellence. We served over 40,000 different individuals last year. Those individuals were provided preventative and primary care, but also the WIC services that were mentioned earlier today. We have been a leader in providing vaccination and testing as we face this pandemic. We have served over 9,000 individuals. 23,000 vaccinations have been provided. In addition to that, we offer our testing daily. Our vaccinations are available daily, Monday through Friday, mornings and afternoons. So we continue to serve the community by making sure that our patients have access to these efforts. We provided the testing kits that were made available by the federal government, and also we've provided the actual mask. So we've had those services and activities available to the patients here. Lincoln has continued to work very closely with the county, with Duke Regional Hospital, with the health system, the Durham County Public Health Department, and social services to serve this community. We have a very strong leadership. Our board of directors, as I mentioned earlier, Mr. Magnon, our current chair of the Lincoln Community Health Center board, is with us tonight. But he and the other members of our board are strong and push us to do our best. We have a very strong leadership team, and we continue to add to that team, and a very strong clinical team that is very passionate about providing services to this community. And sometimes we have to put that passion in check. We have provided medication-assisted therapy to our patients. We've designed programs to address their chronic disease management, such as hypertension and diabetes, through special initiatives and programs, and have continued to do so even during the pandemic. We are constantly concerned about patient access, and because of that, we have reached out and have a plan to add an additional location. That location will be in Lakewood, and it will allow us the opportunity to serve patients in that zip code, and also to add 8 to 10 additional providers. And we're planning to expand our medication-assisted therapy in that program. As you know, behavioral health has been a primary need of Durham County, and we have an integrated model with behavioral health in our current clinics, continuing to provide that service and expanding that as well as we move into this new location. Lincoln will continue to work with its partners in meeting the health equity and health disparities needs of our communities, and we look forward to working with the county, moving this needle to improve the overall health and well-being of this community. Thank you for this recognition. I look forward to working with each of you.
Thank you. Thank you. Comments? Commissioner Jacobs?
Well, I'm lucky because I get to be our board representative to the Lincoln Community Health Board, and I have thoroughly enjoyed being a member of the board, and it is a very unusual board because due to the requirements of being a federally funded public health clinic, a large number, I think it's 40%, you'll have to correct me, Mr. Magnon or Ms. Foy, the number of 51%. Okay, so majority of the board is made up of clients, patients, customers, and so it is a really different experience. It's fantastic. I'm so excited that we have Ms. Foy here, and I wanted her to come and to meet our board because of the pandemic. it's really been hard for us to meet a lot of people in the community. And she has just hit the ground running. She's actually been in this field for 30 years already. So we were so fortunate that she has been a part of Lincoln for decades, and just really, it's just been a seamless transition with her as the CEO of Lincoln. And I wish you were standing up there because I have a few questions. If you could go back for a minute, Ms. Foy, to put you on the spot. And Mr. Simmons, who's standing up, her husband, I would like to recognize him as well. I think just to give a little bit of attention, Ms. Foy mentioned that the expansion to Lakewood, but a lot of people also don't know how many clinics that Lincoln is running all over the community. So if you could just talk for a minute about all the different places where Lincoln is serving, the high schools and all the other health centers.
So we actually have 9 locations. The primary location is the 1301 Fayetteville Street, and that's by far our largest location, where we have 54 exam rooms where we can see patients and offer dental as well as behavioral health, pharmacy, radiology, and lab services. Very comprehensive care. At Hillside High School, we have the John Lucas Wellness Center. So we've provided services at Hillside since its inception, the new Hillside. We also have a clinic in North Durham that we call the Live Well Clinic. It's a primary care clinic, small clinic. We provide services at the Durham Center Access. We call it the Durham Recovery Response Center. So services are provided Monday through Thursday at that location. We have a location, of course, for the homeless, the healthcare for the homeless at Urban Ministries here on Liberty Street. We have 2 clinics located in the health department, which is a very unique feature. Our early intervention clinic, which is the HIV clinic, has been located in the health department since its inception, but we added a primary care clinic a few years ago with some grant funding, and we've been able to serve special populations, especially at that particular location. And then we have the 3 clinics that we cooperate with Duke: Lyon Park, Walltown, and Holton. So we're all over Durham.
We really are. And Lincoln is such a treasure and one of the best health clinics, hands down, in the United States, and a trusted community partner for so many people. So I just want to applaud you, all of the staff who have been working so hard during the pandemic. We were, I think, one of the first clinics where everybody got vaccinated. I don't think we lost maybe one person, or maybe I don't know.
We lost one employee.
One employee, but people just stepped up, got vaccinated. I also wanted to give you a chance to talk about the MAT clinic, because I know that some of our staff and Commissioner Burns is at a conference, but Ms. Foy has already discussed with me as our board representative. We have an MAT clinic that is very successful at Lincoln, but the problem is that we don't have enough funding to provide for everybody who wants and needs treatment. So we're lucky when we think about using our opioid money that we have already tried and true programs that are in our community. And if you could just speak a little bit about the challenges that we have with the MAT program.
Correct. So one of the initial startups when we expanded our medication-assisted therapy was through some funding that we received that allowed us to cover some of the expenses for the patient, primarily the cost of the medication and the visits. These patients are required to have multiple visits. So as a person with a chronic disease, you may be requested to come in every 3 months. These patients come in sometimes every week, sometimes every 2 weeks. So those copays can be a barrier to them receiving care. On top of that is the cost of the actual medication. So as we continue to try to serve a number of patients in our program, we want to have more waivered providers who are able to prescribe these medications, but also be able to cover some of the expense so that these patients will continue to stay in treatment. We've had some good successes with our patients staying in treatment, but as you know, I think over the last 6 weeks, we've also had about a half dozen of individuals who have come on the property who we've had to revive by offering the medication Narcan. So this is a community problem, and we want to be on the forefront of addressing it and working with our partners with additional resources we think that we can.
Thank you.
Thank you so much, Commissioner Burns.
And now it's on. I have not had the privilege of being on your board, and that is not a request. Commissioner Howard, public health might not be my bailiwick. But what I can say is that I have had the privilege of being a patient.
Oh.
And I know that that is odd for any elected official to say, but I didn't always wear this hat and didn't always have insurance. And I actually think that there's a tremendous amount of pain and suffering that is eliminated by Lincoln Community Health providing very good primary and preventative care. So I do want folks to, when you sit and you think about, who goes to Lincoln and who goes to any of the 9 locations, they look just like me because we didn't always have insurance. They look just like grad students. It's not just what we think is the poorest of the poor. There are a lot of people that don't have insurance. What you provide is a very vital resource, and I was treated better there than a lot of other healthcare facilities. And I thank you for the doctors and dentists, because yes, I did actually have to go there for the dentist once when I was in grad school. So I know that it's a heavy lift to do the work that you do. And as a past patient, I just want to say thank you, and I look forward to seeing what else you do as you steer this ship and expand.
Well, thank you so much. It's really good to hear those testimonials. Lincoln is here to serve everyone. We take insured patients.
Ms. Foy, I go back a little ways. I worked with Gail Harris and served on your board, and it was always a pleasure. And I was around when several of the programs were being created for Lincoln, so I have a long history with Lincoln, and just appreciate all the staff and the board. People from the community that serve on your board, they step up. So it's not just elected officials that people may think that's on your board. Community people serve on your board. So and thank you and the rest of your team for all the work that you do, because it means a lot to this community.
Thank you.
Anything else? All right. Commissioner Carter, you have
Well,
something?
if I may, I just also wanted to say thank you to Ms. Foy, because I learned from being on the board myself all the strengths that you bring to Lincoln. Your comments tonight were so informative, and I didn't know your own personal history, and that makes your service all the more special for this community. My daughter is a primary care provider at Lincoln, and she has just sung your praises from the start. When she found out you were going to step into the CEO role, she was so very pleased. And she's not always the easiest person to please. So
We love her.
So thank
Passionate.
you. So thank you. So thank you so much for being here for our community, coming tonight, and we're really glad that we have you. Thank you so much.
Thank you.
Okay, if there's nothing else? Okay, thank you so much.
Thank
you. General Manager Pierce, do you have something you'd like to introduce? To an introduction?
Good evening to the board.
It's not on the agenda.
Oh.
But that's okay. We want to do it anyway.
Oh, thank you, Madam Chair.
Yes, go ahead.
Thank you to the board. Good evening to the board, interim county attorney, and to our manager, and to all in attendance. I am delighted to introduce our new racial equity officer, Dr. Yasina Yesenia Marino. She started last Monday, so she's been with us for a whole week. And I will say that she hit the ground running. And Dr. Marino will lead in the implementation, monitoring, and improvement of our local government operations, projects, policies, programs, and initiatives to promote equity efforts across the county enterprise and work with our partners as well. I would just like to say, as I said, Dr. Marino started in 1 week, and we've already talked about some really important deliverables that you'll soon see, which is part of the work of our racial equity officer. It's building on our racial equity plan, our internal plan. It's also, Dr. Marino will serve as our liaison for the Government Alliance on Race and Equity. That's our membership network for, there are many members, governmental entities across the country, and Durham County is a part of GARE, so Dr. Marino will serve in that capacity. Also, Dr. Marino will be able to hire our 2 equity positions that this board established last year, and so we're excited about that. And also, Dr. Marino will serve as our staff support to get the Racial Equity Commission up and running. So really excited about those immediate deliverables, and thank you for this time, and I introduce Dr. Yesenia Marino. Thank you.
Thank you. I just wanted to say I'm very excited to be in this position. I'm very much looking forward to being disruptive to status quo in the name of co-creating a more equitable Durham County.
Welcome. We're excited to have you, and we're excited about the work that you're planning to do. This is a conversation that this board has had for a long time, and we have a new manager is excited about this conversation. So we're just excited to have you
The feeling is mutual.
to take this on. Yeah. Any questions or comments from the rest of the board? Commissioner Burns.
Really quick, I think you sold me. You know, I've read the bio. You read the papers. You know why you here.
Yeah.
It's a heavy lift. I have the expectation that you will lift heavy. That's your boss, and that's your boss. That's it. You said that you want to be disruptive to the status quo. That's the standard I'm gonna hold you to.
I'm here for.
Welcome aboard.
Thank you.
Anything else? Commissioner Commissioner Jacobs. Yeah.
Well, I did get to meet Dr. Marino before our meeting started, but I just wanted to publicly welcome you, and I'm excited that you're here and to have your perspective that you will bring to this position, and also look forward to supporting you in your work. And please let us know what we can do to support you. Thank you.
Anything else? You know, about a year ago, the National Association of Counties asked me to serve on their DEI board, and it's been interesting in the languaging of around racial equity. So I really look forward to the systemic issues that we begin to grapple with, the systematic issues. You know, the Racial Equity Task Force took this conversation on, what has it been, over 2 years ago? It's been over 2 years. And we are really looking forward to the conversation moving forward. So thank you for taking this position and coming and making a difference for us. Thank you. Okay. We will move on to our next item. The next item is a proclamation 220179, a proclamation of Public Health Week. And Public Health Week, the board is requested to approve a proclamation recognizing April 4th through the 10th, 2022 as Public Health Week in Durham County. And I've asked Commissioner Alum if she will read this proclamation.
Durham Board of County Commissioners Proclamation Public Health Week 2022. Whereas the Durham County Public Health workforce is a critical component of our emergency response to natural and man-made disasters and widespread disease outbreaks in our country, including COVID-19. And whereas our county and state public health workers have been courageous, inventive, and tireless in their work to protect our residents from the threats of the COVID-19 pandemic, while continuing to perform their other essential public health functions, oftentimes at the risk of their own safety and health. And whereas public health measures to control and eliminate infectious diseases, improve environmental sanitation, and promote healthy lifestyle practices have been the greatest cause of improved health status and increased life expectancy for the residents of Durham County and all North Carolina's residents. And whereas public health plays a critical role advancing health equity and preventing chronic diseases and injuries, resulting in improved productivity and decreased healthcare costs for all North Carolinians. And whereas the Durham County Board of Health is committed to a continued emphasis on prevention in public health and to helping Durham County and all North Carolina reach a better state of health through actions outlined in the Healthy North Carolina 2030 objectives. And whereas communities, local health departments, employers, hospitals, and healthcare providers, individuals and families, insurers, county leaders, and policymakers, faith-based communities and schools and childcare facilities must work together to identify and develop innovative solutions to health problems facing the people of Durham County. And whereas the Durham County Board of Health and Commissioners encourages all residents to recognize that public health is working to ensure that all residents are protected from threats such as COVID-19, influenza, foodborne disease, injury, and chronic diseases such as diabetes, heart disease, and asthma. Now therefore, I, Brenda A. Howerton, on behalf of the Durham Board of County Commissioners, do hereby proclaim the month of April 4th through 10th, 2022 as Public Health Week in Durham County and commend its observance to all county residents and convey our deepest gratitude to those public health professionals who serve our county every day. This is the 28th day of March, 2022.
We have our health director, Jenny, to speak on this.
Good evening, Madam Chair, Madam Vice Chair, fellow commissioners,
Evening.
Madam Manager Sowell, and Interim County Attorney Darby. It's a pleasure for me to be with you and to speak before you in person.
Yes,
Those looks a little different.
it does.
I'd just like to say on behalf of the Durham County Board of Health, where Dr. Rosemary Jackson serves as the chair, Dr. Mary Braithwaite vice chair, and the 200+ public health professionals who are dedicated in service to protecting the public's health, we sincerely thank you for this proclamation. It has been a long 2 years, feels like 15 to be honest, but we know that we're in it for the long haul. And it's moments like these that keeps us going. We are grateful for this great board for your unwavering support and holding us accountable for keeping this vibrant community safe. Your support has meant everything to us. April 4th through the 10th is National Public Health Week, and this year's theme is most appropriate. Public health is where you are. The theme celebrates what we know to be true, and that is the places where we are physically, mentally, and societally affect our health and our lives. I can think of no better place to be than the Bulls City. We are honored and we thank you.
Thank you. Commissioner Long,
I want to make a
you got to
comment.
stay up here.
While Director
I'm
Jenkins,
getting used to this, y'all. I'm sorry.
while Director Jenkins is still here and not trying to escape back to his seat, I just want to say I am really proud to be able to serve on the Public Health Board as the Board of Commissioners representative. And one of the things that's been so amazing about this board and the public health staff is that, we've been dealing with the pandemic, dealing with cyber attacks, and dealing with so many issues all at once. And since I've been on the board, I'm sure it's from before I was on the board, y'all have consistently received award after award for excellence in service. It shows how dedicated our public health staff and public health board are to ensuring that they deliver the best quality work and best quality service to people of no matter what is thrown at them. Thank you so much for your leadership, and I know General Manager Pierce, his leadership in that.
Thank you so much, Commissioner Long.
Commissioner Jacobs?
Well, thank you so much, Rod, for being here to represent all of your staff. And my question is, what are we going to be doing this week to really somehow show our appreciation? Because I don't know how we can show our gratitude, really, to all the staff. I hope we're doing something for them, seriously. Because, having Public Health Week, it's really has a lot of meaning, thinking about what everyone has been doing for the past 2 years. So I really hope that you're getting support and that we are doing something fun or something to make the staff feel appreciated. And whatever it is, you don't have to tell me, but because, I forget where it was. I said, let's have a band or whatever. But so, I just, I don't know. It's just, I hope that we are really going to celebrate this week in whatever we can.
I don't mean to cut you off. Did I cut you off? So I went to 2 funerals this past weekend, and the thing that came up around those was what people have experienced over the last couple of years, and the fact that everybody is in this weird space, that it would be great for the community as a whole to do some type of event in the city of Durham, just have some type of event around. It would be about health and wellness, and just being able to acknowledge their grief and that they've experienced over the last 2 years. So I'd like to just kind of put that out there and offer it as see what the board thinks about, and also what the health department thinks of just having something for the city to participate with us, and just have people be able to come out and experience being together in that grief, the sadness that people have experienced. What's your thought?
We certainly would appreciate that. And of course, it's a little hard to really stand here and really receive the accolades, which I feel the staff is well deserved, but this is what we do. This is what we signed up for. We like to consider ourselves to be silent professionals. We do our work, and we go about our business, and you don't normally hear from public health unless there's something serious going on. And we have thoroughly enjoyed the past couple of weeks in which we could get back to regular public work. But we still have a careful eye on what's going on, as you will hear shortly.
Yeah. Well, thank you. We'll call you back for a little something else in a little bit. But thank you, Commissioner Carter.
Just briefly want to say thanks to Rod and his team. And I also want to say I love public health professionals. I was raised by a single mother who was a public health physician her whole entire life for Forsyth County. I raised up one of my own children who works in the public health field as a provider. And I just think that public health includes all of the work that Durham County supports. Because of what you said, Rod, public health is where we are, where we live. Can't remember exactly what the theme is, but basically it's everything that we fund. It's, it's education, it's transportation, it's healthy food, it's open spaces and healthy places. It's jobs, it's opportunities to build wealth. It is healthcare, but more than treatment of disease, it's actually preventing the disease in the first place. And it's, it's initiatives, it's policies, it's investment, and it's what Durham County does. And so we really, really do celebrate you and thank you.
Thank you so much, Commissioner Carter. And as I like to brag on you all to all of my other health director colleagues around the state, it's a pleasure and a privilege to be able to say I have a very supportive board that gets it. That's important.
Thank you, Ron. We'll call you back in a bit. So we're going to move on to our next proclamation is 220208, Proclamation of National Government, County Government Month 2022. And the board is requested to proclaim April 2022 as National County Government Month. The celebration of the nation's counties is held each April. More than 3,000 counties and 37,984 county elected officials serve more than 315 million Americans. While each county is uniquely different, all counties are dedicated to providing essential services to create healthy, safe, and vibrant communities. NCGM, which is National County Government Month, was created by the National Association of Counties to raise public awareness and understanding about the roles and responsibilities of county government. The 2022 theme for NCGM is Counties Thrive, especially in supporting residents and businesses during the COVID pandemic. Durham County government will host several virtual and in-person events for National County Government Month 2022. For more information about NCGM 2020, you can find this on our website. And I will read the proclamation, and then we'll ask General Manager Deborah Craig Ray to speak on this topic. So, Durham County Board of Commissioners Proclamation, National County Government Month 2022. Whereas the nation's 3,069 counties serving more than 315 Americans provide essential services to create healthy, safe, and vibrant counties. And whereas counties provide health services, administer justice, keep counties safe, foster economic opportunities, and much more. And whereas Durham County government and all counties take pride in our responsibility to protect and enhance the health, well-being, and safety of our residents in efficient and cost-effective ways. And whereas under the leadership of National Association of Counties, President Larry Johnson, he's going to get me for calling him Robert, Larry Johnson, the National Association of Counties, is demonstrating how counties thrive, especially in supporting residents and businesses during the coronavirus pandemic. And whereas each year since 1991, the National Association of Counties has encouraged counties across the country to elevate awareness of county responsibilities, programs, and services. And whereas 2022 National County Government Month activities for Durham will include promotion of the I Love My County Because Art contest, sponsored by the National Association of Counties, DECO educational webinar series, DECO Insider featuring communications in COVID, DECO Library app, and more, an employee celebration of county programs and services. And whereas the state of the county will be presented by Chair Howerton during National County Government Month. The annual highlight is scheduled for Monday, April the 11th, during the Board of County Commissioners' regular session. Now, therefore, I, Brenda A. Howerton, on behalf of the Board of County Commissioners, do proclaim the month of April 22 as National County Government Month, and encourage all residents, county officials, and county staff, schools, and residents to recognize the annual celebration of counties, participate in county government celebration activities, and learn more about Durham County's rich history of community enriching programs and services. This, the 28th day of March 22. Thank you, Deborah.
Good evening, Chair Howerton, Vice Chair Jacobs, Commissioners, Manager Sowell, Attorney Darby, and all of my colleagues. I'm excited to stand before you, to literally stand before you as we're getting ready to celebrate in person County Government Month. As you know, this is one of our signature celebrations that we spend time planning and celebrating and marketing and talking about the great work done by our 2,000 employees day in and day out for the community. And certainly after these 2 years, we have a lot to celebrate. We definitely want to honor our employees with some special events, some special surprises. We have a few tricks up our sleeve. I'm not ready to announce them all right now, but I want them to know that we definitely recognize the sacrifices that they've made, and we want to honor them with some surprises. Certainly, you mentioned the art contest, which will be something new that we will have, and it does come from NACO. We will also do some webinars about the work that we do. We're going to do a couple of DECO insiders on some subject matters in county government, and I want to sincerely thank my staff, Senior Public Information Officer Don Dudley and Public Information Officer Randy Jones for their planning, and they have a few other partners that have worked with them. But again, it is wonderful that we can celebrate what we do day in and day out, and our people have really worked tirelessly over these last 2 years. They have found renewed energy and strength as they go through. They have not failed. They have not fainted. They have given their all and more. And this is our time to celebrate them. So thank you very much for honoring County Government Month.
Thank you, Deborah, so much. Comments or questions for the board? Mr. Jacobs.
So I'm looking forward to what some of the surprises will be, and I hope that we will have an opportunity to just have fun and be together, celebrate life, and maybe Commissioner Carter will even write a song for our entire board to sing together on the ukulele.
Nice.
So,
That seed.
but I'm really looking forward to it. Thank you.
And certainly you all are included in whatever we do.
Thank you.
Thank you. Commissioner Burns.
Yes, ma'am, mine is very quick. To all the county employees, I think a thank you is just so insufficient. My first year as county commissioner, people always say I couldn't have done it without you all. We really, seriously, not this community, not this board, we could do absolutely nothing without you all. So huge thank you. Party in no way do I think so. So I'm happy that GM Craig Ray is being very creative with how she wants to support you all. I do not plan on singing at all. I tell you all that now. I mean, I will sit in the back and lip sync. I'm that person that sits beside somebody in church that sings really good and pantomime. So that is what you will get from Commissioner Burns. But I also wanted to let folks know, I don't know if you noticed, but today we got an email. So the North Carolina County Commissioners Association registration is open. And they also today, or either yesterday, extended the deadline for the Achievement Awards. I'm actually looking at a couple of people in here who got awards on last year. I was in there like a proud mama bear. So if nothing else, you know, as much as we know how great you are, I do look forward to being in Colorado this year. Again, they've extended the deadline to April 15th. So we have plenty of time to turn in everything that we need to turn in so that we can sweep awards this year like we did last year. And I plan on being up front screaming, embarrassing Chair Howerton yet again as you all rack up and just show everybody why we are the best county and why, you know, we set such high standards. So thank you for making my first year as an elected official very successful. I appreciate you from the bottom of my heart.
You're very welcome. And yes, we do know that the deadline is extended.
Thank you. Any other comments or questions? And thank you so much, Deborah, and thank you, staff, and we thank you for what's coming.
Our pleasure.
So, before we move into the consent agenda, I just want to check in with our county manager over here. If you had anything you'd like to say or comments, just want to make sure that we acknowledge you.
Thank you so much, because I was about to burst over here as we're talking about our employees. I'm telling you, they are amazing. And so we are very fortunate to have the caliber of staff that we have. And I've told them, but I would love to say this publicly, I have marveled at the work that staff did with all of the complications, the challenges. A malware attack in itself would have taken out a group of staff. But our team, they were just persistent, did a yeoman's job. I think our IS&T staff, I'm just so impressed by the people I have met, and I have said as much to them, but thank you for the opportunity to say it publicly. And I am just thrilled to have the opportunity to work with such an amazing and talented group of people and such a supportive board like you all. So thank you so much. Look forward to doing some even greater things with you all. Thank you.
Thank you. All right. So that moves us to our consent agenda. So commissioners, we have 9 items in our consent agenda, and are there any items that you'd like to pull from 220134 through 220183? Are there any items that you'd like to pull?
Madam Chair, there's excellent and interesting items on this consent agenda, and I move approval.
Second.
Thank you, Commissioner Carter. Do I have a second?
Second.
Commissioner Alam is second. Roll call.
Commissioner Alam.
Aye.
Commissioner Burns.
Aye.
Commissioner Carter.
Aye.
Vice Chair Jacobs.
Aye.
Chair Howerton.
Aye. Consent agenda has been approved unanimously.
And Madam Chair, I was going to make one quick comment about one item.
Which item?
I just wanted to recognize the item 22-0149, because I know Donna Rewalt is here, and thrilled that we have just approved a full-time bilingual outreach coordinator, and I know that's something that our racial equity officer would be pleased with our doing that. in terms of language equity and access for services. So thank you for bringing this to us, Donna.
Okay, we're going to move on to other business. 22-0192, Durham County Public Health Focus Update on COVID-19 Crisis. And the board is requested to receive a public health focus update by none other than our Health Director, Rod Jenkins.
Good evening again to Madam Chair, Madam Vice Chair, Commissioners, Manager Sowell, Attorney Darby, and General Managers. It's a pleasure for me to be with you, and I'll get right into it. I'll start off, if there was a banner I could kind of put across the screen, I'll just say, things are getting better. That's certainly welcome news to each and every one of you. Total cases for the past 7 days, 337. Deaths have been suppressed. I believe the last time I was before you, we had 312, and I stand before you today, it's 312. Again, our hearts, minds, meditations are always with those who have lost loved ones due to this pandemic. 7-day moving average is 48 cases, and this is a continuous decrease of 15.86% last week and also the same percentage the previous week. Since the pandemic began through March 27th, there are 31,099 COVID cases in Durham County. We continue to keep our eyes and ears on race and ethnicity trends. Once again, I'm proud to report that all facets, all demographics are either proportionally represented or underrepresented within Durham County, i.e., once I get to the vaccination slides, you certainly know why. Our data hub continues to be the crown jewel of our response, and I'm proud to report that my data team has updated our splash page to really mirror that of the CDC's community level transmission. If you were to go to this page, you would see the black boxes that are highlighted. You can click on it, and it would take you to the CDC site for Durham to see exactly where we stand. So we're, again, continue to be amazed by the work and the ingenuity of our epidemiologists, our medical director, and our data scientists. So again, we want to make sure that we lift that up for our community to let you know that that information is still out there and it is updated daily. Percent positives, although we don't really pay close attention to it for the good of this group who has seen me and heard me talk about positivity percentages for 2 years, I still think it not robbery to let you know that we are still hovering below 5%. So we anticipated a slight bump when we rescinded the mask mandate. That only went up a half percentage point. So currently we're sitting at 2% of all labs. And I'm proud to say that we still have testing going on robustly within Durham County. This picture is normally worth 1,000 words. And again, as you can see from our all-time high in the month of January to the present, we continue to go down, and we hope that we remain there. We keep a close eye on the percentage within the past 7 days of hospital beds. We continue to see that downward trend. This slide depicts COVID cases by day, projecting downward. Again, continue to see it go down. The new CDC guidelines are really at 200. We're at 107. Spoke a little too soon, but again, hospitalizations are continuing to go down. Continue to stay in touch with a good friend Katie Galbraith from Duke Regional, who gives me updates on Duke's hospital system, and they are certainly at capacity and able to really do the things that they normally do with regular patients as opposed to COVID patients. I would be remiss in saying that if I didn't say that most of the hospitalizations that we do have are those individuals who are not vaccinated. Per the community level, Durham is in the low level, as is the majority of the state. We have some who are a little bit higher than others, but Durham and the rest of the triangle continues to be low as of March 24th, 2022. Vaccine updates, again, nothing much has changed. Our dates and times are still there. We do have an outreach event with a trusted partner, so it feels a little strange to get back out there, but the time is right. Not that we're going to have a sustained level of outreach, but we were asked, and there's no reason why we can't partner with El Centro Hispano to have a vaccination event coming Friday. Our vaccine dashboard, as I alluded to earlier, by race, we do have the white population of Durham at 61.26% fully vaccinated, Black African American 50.29%, our Asian population extremely high at 75.39%, and our Hispanic and Latinx population in Durham is right at 64.24%. So all of our efforts are really paying off, and we're continuing to beat the drum for boosters and vaccinations. As I said so many times before, I apologize for this slide being slightly busy. We wanted to depict those individuals who've had 1 dose, 2 doses, and 3 doses, which represents the boosters. As you can see, it's on the incline. I'd like to give a shout out to those who are our seniors who are 65 and older, because that wisdom is on display. When it comes time for them to get their booster, they came out in force. And they represent the highest demographic that we have at 79.94%. We're continuing to work with the state and a number of campaigns, particularly the spring into summer campaign, where we're doing a whole lot of advertising to get people to really consider boosters. And we're certainly hopeful that that will reap dividends. COVID testing is still going on strong. Again, we have many partners. Loretta Foy is one of them with Lincoln. We certainly want to make sure that we lift them up. But the county and state-sponsored COVID-19 sites still include Centro Hispano and our good friends at Fidelity Investments at RTP. We're certainly happy to be working with Leslie Walden and ensuring that that site is publicized. Again, testing is still available, but again, I also want to indicate that we still have over 30 locations in Durham County where folks can go get a COVID-19. Final thoughts. Just want to make sure that I, for your edification, vaccine and boosters is still the key to ending the pandemic. All key metrics remain low. Positivity rates and hospitalization information are still located on our dashboard, and we'll make information more accessible. As far as COVID metrics, we know that the state has gone to a series of 7 individual metrics. We are already or have been tracking hospitalization data, case trends, boosters, and CDC community level. These are also available on our dashboard, Data Hub. We publish them in our bi-weekly reflection now. Wastewater surveillance has been something that we have been monitoring and receiving information on for several months, really since about September of last year. The only thing that we find a tad bit unreliable is the fact that there are 3 sections of Durham. There's South Durham, Central Durham, and North Durham. And unfortunately, we only receive information for South Durham. So that kind of makes it a little less reliable, if I may be honest. And there's also a two-week lag in the information that we receive. Nevertheless, I did petition the state earlier today to ask them if they could get us the information for the Central and North Durham. They did say in their next round of considerations that they would consider that. So we will see what happens. As far as variants, of course, Dr. Jinks, Jeff Jinks, is our medical director. He's forged a great relationship with Duke, and we're certainly going to capitalize on their sequencing that they do in an effort for us to be able to have our own analysis and not necessarily have to wait on the state. So we're continuing to work on that. Of course, COVID-like illnesses and syndromic surveillance is available to us through North Carolina's NC Detect system, and we're tracking that closely. Final thoughts I just say is that we have not veered away from keeping our eyes on COVID. It's still a clear and present danger. There's still people who are getting sick due to COVID. But as I alluded to earlier, things are getting much better. Lots of immunity in the community. But as public health director, I still admonish the listening audience. You've not gotten your COVID-19 vaccine, it's not too late. Not gotten your booster, I strongly admonish you to do so. I do know that, as an aside, I do know that District Attorney Santana DeBerry did a wonderful public service announcement most recently, and just really detailing her experience with COVID. And we felt that was very, very tastefully done, and she did give a nice shout out to the Public Health Department. Happy to answer any questions you may have.
Thank you, Ron. Questions, comments, Commissioner Long?
Thank you so much, Director Jenkins, again. I had one question I had two questions, but the first one was around the age group slide.
Commissioner Long, could you speak a little louder?
Yeah, can you hear me now? Okay.
A little bit better.
In the age group slide, I had one question about the graph. I just noticed one thing, and I was just a little confused by it. If you could clarify it for me. In the 80 plus graph, it showed that the percentage of individuals who are 80 plus who got their second dose was higher than the individuals who got their first dose. So I was just wondering how that was calculated, or did I misinterpret that?
Good thing I printed it off. Let me make sure I check. And you said it was individuals who were 80.
Yeah, so if you look at the last line, the blue for second dose is up to 90%, but then the first dose was 86.
Could be a number of reasons. Would love to be able to get back with you, but again, we're talking individuals who are 80. So I don't want to sound morbid up here, but it could be a number of different issues. But happy to research that for you, Commissioner Long.
Thank you. And then my second question was around the mask mandate. I know we have just moved back to making masks not mandatory, but recommended. And the current rule that we have, or metric that we're looking at, is basically if we get into orange or red, then the mask mandate would be reinstituted, right? And orange and red, is that decided based on COVID cases or hospitalizations?
A little bit of both. You have the COVID cases overall, you have hospitalization, and you also have the community spread. So my commitment to my chair and Mayor O'Neill is that if I saw a sustained level of increase, I would reconvene them at their earliest and let them know what the details were, myself and the medical director, and we would humbly ask for them to reinstitute the mask mandates. But knock on wood, we're hoping that that's not the case, but that was my commitment to the mayor and the chair.
Thank you so much.
Absolutely.
Commissioner Burns?
Thank you so much. Rod, as always, thank you. I actually think sometimes, I've worked with a lot of graphs. I just feel like y'all sit in the office and say, what graph can we make this week? Like, what investment can we make in Adobe? Because they're never the same. They're always intricate, and they always do a good. I was with Commissioner Long. I sat in my spirit and thought to myself, well, maybe it's 90% of the 86% that came back. Or maybe some people passed away. And I'm not going to ask what she did, so I appreciate her asking. Mine, I'm going to pivot a little bit. Two things. I know you said you've made that request about the other two centers. I did get to do the water proclamation for World Water Day this weekend. I know a lot of folks are watching. So in the event, I heard some of the advocacy on this weekend. In the event that you need us to aid in your advocacy to get those other two locations added, if you need the strength of these 5 women that support you so much, because that's what you said earlier, that you have a board that understands, let us know, how we can fight and what letters we have to write so that we can get those other 2 locations added. And I did want to pivot. I heard we had a public health day at church, and we've seen some people get flu and strep at Duke. And so I know we're a little bit past flu season, but, as people are taking off a mask and as people are, we're going into these other seasons, we're starting to see an uptick in some of these other things. So maybe not this week, but I did have kind of sort of two questions around that. One, how are we pivoting, into some of these other communicable diseases so that we can do significant outreach so that we can maybe have numbers like these for some of these other vaccinations? And two, are we seeing an uptick in these? I mean, I shudder to think that, all of a sudden we say take off mask and now people are not washing their hands, right? Like, so that's the struggle I'm having. But it seems like as soon as we said take off your mask, they're like, no, I can now go lick old bus seats. And I know that sounds morbid, but that is what somebody said to me in the public health department, so blame your staff. That was the language that they used. So are we seeing an uptick? And if we are, like, what are some things that we can do to let them know that these diseases are just as bad?
Great questions. Thank you so much, Commissioner Burns. To address your question about whether or not we're seeing an uptick in other illnesses, particularly with the flu, the answer is no.
Okay.
Fortunate for me, every Friday I receive emails as it relates to syndromic surveillance. The main one is flu. And while we'll have like an occasional bump regionally, it's not really been anything of concern. So again, the masks that we're wearing, the hand washing, all of those things are really paying dividends. And, I know Joanne can attest, in public health, these are the things that we've been trying to get people to do for years. And unfortunately, it took a pandemic to really drill down and really put inside people's psyche that it actually works. So it's been certainly a pleasure for the past 2 to 3 years to not have a flu season. Not to say that it's not there, but it's not as pervasive as it was. We certainly still want people to get the flu shots if that's their choice, but I think we're good to go. And on the advocacy front, we certainly appreciate that offer. There have been, I think most recently was something with the I think it's the U.S. Food and Drug Administration that we reached out to Madam Chair and the clerk, and they were right on it. So we certainly appreciate the partnership.
Thank you, Commissioner Carter, and then
Thank you. And thank you, Rod. Let's see, I have a couple of questions, a couple of comments. There was one slide with gray dots, or it had gray shading over it. And I just was wondering what that was. It looked like the numbers were going up, and I thought maybe it seemed like the date was in the future. So maybe that's modeling, a prediction for our increased percentage of ICU beds used. That was the one that went up. I wondered if.
Mm-hmm. Yes, ma'am.
And that brings me to my next question, which is, it seems like the sages who claim to know expect that we are going to see and I guess I'm just wondering, what are your thoughts on that? And, do we need to be redoubling our efforts around getting boosters into people's arms? Or, what are your thoughts on this?
Absolutely. We're keeping a close eye, Commissioner Carter, on those subvariants, if you will. Again, not to geek out on data, but again, you have 3 subvariants. You have the BA1, which was the original one that was going around with Delta. You have BA2, which is what they consider to be the stealth variant. And then, of course, you have BA3 that is not as well known. With that being said, BA2 is the one that everyone is really concerned about, and it is mimicking the activity of Omicron. For the most part, if somebody gets COVID right now, it may be considered to be BA2, they'll get sick, and then all of a sudden, they get well. So kind of like how Omicron came and kind of wreaked a little bit of havoc, the subvariant is here. It has been here in North Carolina for quite some time, but as far as the high level of activity that it has in other jurisdictions. It's just not here. That information has been verified by Duke, our medical director, Dr. Jeff Jenks, and also state epidemiologist, Dr. Zach Moore. We're continuing to keep a close eye on it. As mentioned earlier, Duke is doing a lot of sequencing in their own surveillance, so we talk with them just about every other day. And the moment that it really gets to the point where we are seeing like way too many cases or whatever, that's when we'll ring the alarm. But as it stands right now, it continues to be at a reasonably manageable level.
Is absolutely the most important thing. People need to get those booster shots.
Absolutely.
Which brings me to my next question is, I heard that those who received a booster more than 6 months ago and are 50 or older, which category, can get maybe the second booster or fourth shot. About that, are we that?
It's my understanding, Commissioner Carter and others, that is being considered. I think prior to that, they are definitely wanting to get that next demographic taken care of first. That is those individuals, really the babies, those who are 6 months to 4 years old. We have a very important meeting coming up on April the 6th. And I think shortly thereafter, we can expect a flurry of activity. We do know that Durham, there's some pent-up demand for it. As a parent, I am one of them. So I think they're going to kind of get that out of the way first and then, really see about some additional boosters. But as I joke to all of my public health friends, if they told me to get a booster every Monday, I would. I'm pretty sure you feel the exact same.
And I'm glad that you're putting additional emphasis on the waste.
Commissioner Jacobs.
Well, thank you, Rod, and I appreciate the way you all have pivoted with the data points now on the dashboard. That's really helpful. It's amazing when you just presented the racial demographics to see that among the Latinx or Hispanic population now being 64.27 or I can't read my own writing, 27 or 21%. But anyway, it's higher than our black and white population, which is incredible because in the early days of the pandemic, we had a real scare with the Latinx population having the highest rates of infection, and to see how successful vaccinations have been. And I want to give credit to everyone in our community who has been a part, the community health ambassadors, El Centro, all of the trusted community partners who have really made that possible. It's really
Excellent point that you made as usual, Madam Vice Chair. And I remember those days back in, I want to say anywhere from late March to early April of 2020, where we really had to sit down with our Latin 19 colleagues and really let them know how serious it was. But I'm proud to say, I'm very proud to say that ever since that meeting, and when it was sort of like state of emergency, it has literally gone up. Well, as far as infections, down. As far as vaccinations, up. And it's continued to do that. And to your great point, it's because of Latin 19, El Centro Hispano, El Futuro, La Ley radio station. I could go on for days. We were able to really be true partners with them in an effort to ensure that that community understood how serious it was. And you're certainly bringing back some memories, because
Yes.
I remember how hard it was. But at the same time, it's great to see that it's continuing to go down. And again, just want to lift up Lincoln Community Health Center, because they played a critical role in that, as well as our partners.
right, absolutely. And just following up on that issue, I was wondering what you're hearing about funding, because we heard at our Lincoln meeting just last week that we are no longer going to be reimbursed for the vaccinations and at Lincoln, because as you've been hearing in the news, that the federal funding is running out for the vaccinations. And so I'm wondering, and maybe the testing too, so I wanted to hear from you, how is that looking for us as we look forward with being able to provide free vaccines and testing? I know Lincoln, Ms. Voigt told us that they are going to still be providing free vaccines, and we're going to figure out some way to cover it. We will not stop. But so I just was wondering where we are at with Durham County Public Health.
Great question, Madam Vice Chair. And no changes in our operation. As far as funding is concerned, we still have quite a few, several thousands of dollars to continue this work. We're continuing to utilize the resources of the state, and that's our partners at OptumServe that's continuing to provide the testing at El Centro Hispano and also at the Fidelity site. And until, they tell us that, they can no longer fit the bill, then of course we'll fall back on the funds that we have. But I feel confident in telling this board that we're in a good place. And I do believe that we'll be in a great place for months to come.
Great. I'm really glad to hear that. And we, as you've said, getting vaccinated is the best thing that everyone can do, and getting boosted. And I'm wondering, I know we have tried everything, but I'm thinking maybe we need to work with the schools and have our children as the new ambassadors for, and we need to improve our vaccination rates with our kids too, but bringing their parents in to get vaccinated, and their grandparents and their aunts and uncles. So I hope that we can, just not give up on that. And I really want to really lift up all the people in our community who are immunocompromised and who really still are at great risk, who cannot be mask optional. And how important it is that we keep remembering the people in our community whose lives really are at risk, and to keep it we need to keep thinking about everyone in our community and trying to make everybody safe. So thank you, and I'm glad to hear that we are in good shape financially.
Thank you, Madam Vice Chair.
Commissioner Burns?
It is very, very quick. Can you hear me, Rod? And I will tell you, when I first got on this board, I'm happy she brought up the demographics information, because I looked at the number tonight and I had to double check. Correct me if I'm wrong, African Americans, we're at 50.29. I remember when I first got on this board, I literally sat and prayed at night and said, God, let us get over 50%. And that has so much to do with the work that we did on this board, but more importantly, the work that you and Joanne did. And I argued with my colleague. I did. I really argued because I didn't think you all really got it. I think y'all get it now after we've all talked, but it literally speaks to the level of mistrust that you have when you have grown up in this environment. I think a lot of our Latinx brothers and sisters have not gone through the trauma of what it is to live in this country that I love. And so the proposition, the value proposition that you all made at El Centro and on the radio could be consumed. And that is why we see the 65 to 75. And I think a lot of you all know my dad had surgery last week. And I'm happy to say that he is up and at 'em and back at his barn. And this was a heart surgery, y'all. He had a valve replacement last week. And a lot of you all couldn't get a hold of me because he actually had a doctor in the hospital to come in one morning and say, you know what, sir, you're old. Like, there's risk. I just don't think we should do this. And he was like, you at this point, and my dad at that point was like on 100% oxygen, a level 4, couldn't breathe, every morning waking up with fluid in his lungs. And we were pulling fluid out every day. And I just knew that it was crap. And I knew that they were doing it because he was older and he was black. And we are not offered the best therapies. So I was there the next morning at 7 a.m., even though visiting hours didn't start to 9. And when I got in there, because you got to be in there when you're black, I got in there and I sat down and I waited for that team to come in. It was a whole new team of doctors. And the lead doctor says, Mr. Burns, I don't know why he told you that yesterday. I got 4 different ways to do this surgery. And so that was last week. My dad has a valve replacement. And again, he is back to feeding his chickens and being at the barn. So again, I applaud you all for getting to over 50%, because I didn't think that we were going to get there, because consistently present day, we go into hospitals, we are denied services. And it was hard for me to watch my father, who served in this country, in the Air Force, to sit there and say, this man told me to go home and die. And he said, well, sir, if I'm going to die, I'm going to go down fighting. And he would have, they said if he would have went home, he would have died. Like, there's no question about it. And now he's up and at him and fine with the valve replacement. So that 50.29% was not easy for the people in this room. And I do want you all to take a bow and thank you for doing your best to make sure that people who look like me had a fighting chance. And I hope we can get it higher, but that was a heavy lift.
Thank you for sharing that.
Thank you, Rod. Just one question. So, to the community, what crowds, out in crowds, would you recommend people wear a mask when they're out in crowds, or not? Or you just kind of leave it up to individuals? He's like, are you?
I'll say, heck yeah, wear your mask.
He's
not going to hurt
He's looking at me like, I don't know if I'm going to answer that or not. What do you think?
Well, I want to make sure I understand the question.
Question is, would you recommend, when you're in crowds, to wear a mask?
I would, and it's not to say that, it's unsafe. It's again, we want to make sure that we use whatever precaution is necessary to prevent the spread of disease. If we know that, you don't know who has what. And as we've been saying for so long, masking is an act of kindness. So, again, the same way that you don't know what that person has, that person don't know what you have. So as a result, you're not feeling comfortable. If you want to be, safe, completely safe, and you're going out, put your mask on. I feel as if I have a family of epidemiologists now, but especially with my 4-year-old, when we get in the truck, she just like, Daddy, mask. Yes, ma'am, mask. So I would just say, yeah, until we get to that point where we have the Walensky's of the world and the CDC's telling us we have the all clear, wear your mask.
Thank you. Thank you very much. That brings us, thank you for your report. And again, thank you for all the work you and your team do for this community. So that brings us down to the end of our agenda tonight, Commissioners. And we want to thank the public for being with us on our second in-person session. Thank staff for being here. And the next item is that we go into closed session. The board is requested to adjourn.
We got appointments, Madam
Is there
Chair.
something? Did we miss that?
Number 8.
Okay, it's not on this one. Okay. It's not on this. Maybe it's on this one. All right, I got it. I definitely don't want to forget my attorney over here. Give us some information on boards and commissions.
Good evening, Madam Chair and other commissioners. It gives me great pleasure to announce the people you have selected for appointment. First, to the Durham County Women's Commission, you have selected Socorro Bullock. To the Juvenile Crime Prevention Council, you have selected Ahmad Ali. Those are your new members.
Okay. Well, thank you, Attorney Darby, that. And the Board of Commissioners appreciates and recognizes the citizens that participate on these boards. We know that we don't take it lightly. There's so many things that we would not be able to do without the citizens' participation on these boards. So thank you so much. And congratulations to the people that are appointed tonight. Okay, now we're at closed session. Is that correct? All right. So, the board is requested to adjourn into closed session for the following: to discuss matters relating to the location or expansion of industries or other businesses in the area served by the public body, including agreement on a tentative list of economic development incentives that may be offered by the public body in negotiations pursuant to GS 143-318.11A4. Get a motion to move into closed session.
So moved.
Moved by Commissioner Jacobs, second by Commissioner Alam. Roll call.
Commissioner Alam,
Aye.
Commissioner Burns,
Aye.
Commissioner Carter, Vice Chair Jacob,
Aye.
Chair Howardson.
Aye. Approve unanimously. We are moved into closed session.
How many of y'all want to go?
We have met in closed session, give direction to staff, and no action to be taken other than direction to staff. I need a motion to adjourn.
So moved.
To adjourn, Madam Chair.
Second.
It's been moved and properly second to adjourn.
Commissioner Long,
Aye.
Commissioner Burns,
Aye.
Commissioner Carter, Vice Chair Jacobs,
Aye.
and Chair Howerton.
Aye, we are adjourned.